Hey guys, Dr. Brent here, and I want to go through your at-home rehab kit. And I know that can seem a little bit overwhelming, but I will tell you it is so critical for you to make sure you are doing your at-home rehab to help support all the correction that you're getting in the office. This is what's going to help strengthen and stabilize and get you to hold your adjustments, giving your body that opportunity to heal. But let me kind of break this down. So in your rehab kit, you're going to get a couple booklets. I want you to start with this. This is the Spinal Correction at Home Quick Start Guide. So in the beginning, it's going to kind of walk you through the importance of it and really why you're doing it. And then it's going to give you an order. So ideally, just like you do here in the office, there's an order to your rehab. You want to start with the warm-ups. That's the tractions, that's the wobbles. Then you're going to get into some of the isometric exercises. Those are the ones where you're holding the movement, and then there's some of the body weighting, and then there would be the passive molding, which would be your wedges and or laying on your spinal molds. So let's get into it. Now there's also going to be examples of how to do the actual warm-ups or the actual rehab. Now we're also going to be sending you a video of the different movements, so you'll have specific videos for each different rehab exercise. And remember, this is tailored to you. So you are not going to do all the different rehabs that you see in the booklet. You're only going to be doing the exercises that are specific for your spinal misalignments, your subluxations, to get you the best correction and the best results. So make sure you start off with going through this booklet. But let's go and break it down. There is what's in your home care kit. So this is kind of giving you the idea of what all is included in there. And on the back, there's some information about posture and some ergonomics. So again, just another really great resource to go through. So let's start with the wobble. So the wobble is going to come deflated, okay? And so it comes with a pump, like a pump you'd pump up like a basketball. And there's kind of a secret to it, but you kind of have to like kneel on it as you're pumping it up, and it just helps to make sure that the air is flowing in there. And it doesn't really matter how much air you put in there. If it's similar to what we have here, that's probably a good start. But you know, don't get too stressed if you don't have like the exact air, or you know, if you can't fill it up at all, it still really works. I mean, there is air in here when it comes with it, but put a little bit extra air in there and it'll definitely help. I would definitely suggest putting this like I put it in my coffee table, so when I wake up in the morning, I'm doing like my morning routine, or I'm having my coffee, boom, I get in there. First thing in the morning, I'm doing my wobble. It just helps to get the juices flowing. It helps to really warm up the back, the muscles in your spine. It helps to hydrate those discs to stop any of that degenerative process. But it's just a great way to start your day in the morning. But the pump is in here as well. Kind of looks like this. Okay, so there's your wobble. Now the next is your traction unit. Okay, so it comes like this. So remember, these rolls, they move in and out. So depending on what is going on in your neck, these will either be apart or they'll be together. And again, that should be in your prescription sheet as well. Now, instead of, you know, like we have in our office on those metal L brackets that are drilled into the wall, yours comes with this. And so you'll attach it to here like so. Well, it comes apart and you put it together. And then this goes over the door and it shuts the door, so where my hand would be the door, and then you attach it here, and so it gets you away from the door. So instead of like pulling down and jamming your elbows into the wall, it's upway, so you're able to pull straight down. But there's an additional video specifically how to put this on over your door. You do have a travel one, so instead of like if you're traveling, and we recommend that you take your home care kit with you, instead of taking that block, it just comes with a little thing that does just go over the door, and so you can shut the door and you can do your rehab and you don't have to have the block with you. So it comes with this little travel unit as well. These boxes are your progressive rolls, and the progressive rolls are what you lay on at night, and the idea is to try to sleep on them all night. You have two sets. You have the firm set, which are these darker ones, and it comes with a cover as well. So you put this cover on, kind of like a pillowcase. But you put that cover on, the large one goes underneath your neck, the smaller one goes underneath your lower back. And the idea is you start off 10-15 minutes laying those to help support the curves in your spine, but eventually you want to be able to sleep on them all night. That way you're able to do your spinal rehab the entire night. Now, I know some of you are thinking, well, I'm not a back sleeper. Try. Now, do your best. Lay on the rolls as long as you can, and then if you're a side sleeper, roll to your side, normal pillow. Make sure it's big so your spine is straight if you're on your side. If you're a stomach sleeper, you know, it's not the best for your spine, but I totally get it. If you are what you are, but try and land your rolls as much as you can to help with supporting that curve. Once you're able to do about 2 hours or so on the on the medium or the softer rolls, try and graduate to the firmer rolls. So again, you have both the softer ones you start with, and you have the firmer ones where you're gonna work up to. Next is your head weight. So it's in this box. Now it comes with all the weights in here. Okay, now you're prescribed a certain number, whether it's a number 2 or number 3 or number 4. So you're going to make sure that you're only putting in the amount of weight that you're prescribed to, but I want you to have all the extra weights in case we want to graduate up, start adding some more weight because your spine again is getting stronger and we're trying to add some extra rehab stuff. And then you have your pelvic wedges. So this is what you'll also lay on to help correct like pelvic rotations, imbalances in the hips. And again, you'll start off with like 10 minutes or start off with like 5 minutes and you're gonna try and work up to 10, maybe 15 at the most. These are not designed to lay on all night. Ideally it'd be on the floor, but if you have a hard time getting up and off the floor, laying on your bed would be like a second choice. Better than nothing, but obviously the floor would be a little bit better. But I totally understand if it's really hard to get on and off the floor, if you have bad knees, or you're just in that much pain in your back, you're not quite able to do that yet. So that is what is in your home care kit. Go through that, check it out, start to get this stuff set up. Go through the other videos so you can learn exactly how you're supposed to do those specific individual rehab exercises. And then please make sure you're asking questions, whether you have, want to make sure that we check to make sure you're doing it correctly, or you're just like, I have no idea how to put these wedges or whatever. We'll make sure that we get you the best results. Because remember, this exercise is critical, consistently done to help support and correct your spinal adjustments, just like rubber bands on braces. The more you do, the tighter you get, the more they do, the stronger, the more the teeth move. Just like we're trying to change your spine so your body has the optimal ability to heal and function. All right, guys, if you have any questions, make sure you ask us in the office. We'll talk to you later.